Good morning, Ananda. In previous class, we have discussed about the EEG. Today, we are going to see on the topic of EMG. EMG is nothing but the electromyography. Electromyography is nothing but to read the electrical activity of the muscles. EMG stands for the electromyography, which is a medical test that measures the electrical activity of the muscles and the nerve that control them. In this test, small electrodes are inserted into the muscle being studied or placed on the skin overlying the muscles. To detect and record the electrical signals produced by the muscle activity, the EMG test can be used to diagnose various neuromuscular disorders, including muscle disease, nerve damage, or injuries, and disorders affecting the spinal cord. It can also be used to evaluate muscle function before and after surgery or other medical procedures. EMG is safe and minimally invasive test that typically takes around 30 to 60 minutes to complete the full length test. Depending on the number of muscles we are going to diagnose. The test may cause some discomfort or pain that is usually mild and temporary. EMG results can be provide important information for diagnosing and managing various neuromuscular disease. We can see the block diagram coming through, in which the electrodes are placed on the body parts of a patient, through which it is connected to the amplifier. In medical mechatronics, amplifier plays a major role for gathering the low pass signal. Then the amplifier is connected to the EMG recorder and also to the AF amplifier and to the oscilloscope. Through the oscilloscope, we can able to get the output and also the graph. Through the graph, we can see the graph in this slide, through which the output graph of the EMG typically displays the electrical activity of the muscle being studied as a series of wavy lines. The graph is usually displayed on a computer screen or printed on paper and can be analyzed by a trained healthcare professional to detect any abnormal patterns or activity. The EMG graph will typically show two types of signals: resting or background activity and active muscle activity and resting background activity. In resting activity, this is an electrical activity that occurs in muscles when they are at rest. Normal resting muscle activity is typically low in amplitude and regular in frequency. But in active muscle activity, the electrical activity that occurs when a muscle contracts or moves. Normal active muscle activity typically shows a pattern of brief bursts of high amplitude electrical signals, through which the activity we can able to rectify which the muscles are in good conditions or in a disorder. Thank you.